As we know, on the last months, our reality has been changing because of the COVID-19, since we had to make social distancing and quarantine.
But not all governments and countries have the same opportunity to confront the virus. But in general, all countries have been affected in a different way. Also, the way each country is following their protocol makes the big difference in all the people confronting the virus, and the virus is taking advantage and is killing two birds with one stone.
This has affected many aspects of our life, like the economy, and the countries are making a big effort to decrease the consequences and their impact.
The situation is piece of pie, as well almost give an extra sport.
Since supposedly the quarantine is ending in a few countries, most of the governments have started their plans to return to our new reality.
So, we should review some of these plans that are pretending to give us a new reality. Also, review how different countries, governments, and citizens have reacted and have been affected with this virus.
Countries have reacted in different ways. For example, European countries reacted very late because they didn't knew the magnitude of the virus, while American countries started quarantine before for them to keep citizens safe and healthy.
The situation has created many dilemmas, as mentioned before, but we have managed to solve them in different forms.
However, similar moves by the Italy's Prime Minister Giuseppe Conte to isolate millions of people in its northern province and the Monday extreme decision to lock down the entire country could prove more difficult to implement in Europe. This data according to Forrester 2020.
Well, according to Bradley J., a reporter from the New York Times, the United States and European Union countries commit to have better medical equipment to combat the coronavirus. Another troubling divide is also emerging, with poorer countries losing out the wealthier ones in the global scrum for masks and testing materials. Scientists in Africa and Latin America have been told by manufacturers that orders for vital testing kits cannot be filled for months because the supply chain is in upheaval and almost everything they produce is going to America or Europe. All countries report steep price increases from testing kits to masks.
As Forrester 2020 said, from left, Chief Medical Officer for England Chris Whitty, Britain's Prime Minister Boris Johnson, and Chief Scientific Advisor Patrick Vallance speak during a press conference about coronavirus in 10 Downing Street in London, Monday, March 9, 2020. The UK's Chief Medical Officer, Professor Chris Whitty, has helped millions make sense of the crisis among the sea of information, with calm and assured answers to the questions on everyone's lips. He's been described as properly impressive and the expert we need, and even touted by some as the next 007.
The picture is similar in Spain, where government officials are spreading a message of alert but not alarm, focusing on the early detection and containment of causes. Neither country though has imposed restrictions on internal movements of residents.
Let's talk about how two different countries are returning to reality or how they are making a new reality. Let's contrast two different countries. The first country we will talk about is the UK. The UK is a country of first world, so their plan is supposed to be better than the Mexican plan. The government has one of the most generous and comprehensive support packages in the world, providing security and support for those who get sick or can't work, and a bridge for business to protect people's jobs. In another way, let's see the reactivation program of Mexico, that is a third world country. According with Sherman 2020, the economic reactivation remains constant with the president administration priority of helping Mexico's most vulnerable touch gender public spending. As I said, this plan is helping the Mexico most vulnerable touch gender public spending on social welfare, keeping people employment and cutting costs in the sprawling government. And one of the actions that the president will be doing is reduce the salary of the top government bureaucrats such as him. As we can see, the reactivation programs between these countries are different because one it's a third world country and the other is a first world country, so their economies are different.
Taking in consideration, Spoljaric M., the Assistant Administrator and Director of UNPD and European and CIS, says that the coronavirus COVID-19 pandemic is an unprecedented challenge in today's fast-changing world, and we are facing it as a global society. Like climate change, it is testing our resilience in sectors of the economy and all areas of development, from public health, social protection, and governance, to information sharing and economic policies. And just as with the climate change, it will take the efforts to everyone working together.
Another problem that governments face is the disinformation of COVID-19, since many people still don't understand that we are in dire straits. And by this, the governments know neither night or day nor day about it.
The OMS explains that infodemics are an abundance of information, which makes it difficult for people to find real sources and a reliable guide when they need it. During the health emergency, rumors, misinformation, and misinformation are spreading, which can create confusion and mistrusting among the population.
At the end, I think we can all see that during all these hard times, the world is facing more problems than once we had in mind about dealing with deaths and new cases. Even us, being teenagers living the pandemic, we came to the conclusion that even having these points are needed to be taken in consideration, there are a lot of things that this new virus has brought to us. Having the internet and social media has made us be more aware than ever about what's going on around the world and all of our surroundings.